slightly lower. 70? It's closer to about 67%. 67% from the recent studies that was done. And so now you can start to see why our youth are turning to social media, because that's an income source for them. Over 41% of our youth are making an income on social media, right? And if there's no alternative for them, why not go to YouTube? Why not go into Instagram? I can get $100, I can get $1,000. So, another question for you. Here in Kenya, we are unbeatable. We are unbogable when it comes to social media. America, they know. South Africa, you can't touch us. What is the average time we spend on social media? Youth, adults, all of us. Does anyone know the average amount of time? 10 to 14 hours. So this is on social media, not you're working 10 to 14 hours. For adolescents, for adults, it cuts across, okay? Anyone else with an estimate? The actual, yes?
12 hours.
12 hours. The actual average amount of time a Kenyan spends on social media is 3 hours and 43 minutes. So when we look at online platforms for school, for workplace, yes, it will come closer to the 12 to 14 to 12 hours, but for social media, that's almost half your working day. 3 hours, 43 minutes. The global average is around maybe 2 hours and 30 minutes. So we're spending, that's globally. In the whole world, Kenyans are the ones who are spending the most time on social media. That should really start to tell us something, right? And Shamiri, there's a report that you did that looked at Kenyan adolescents, and 37% of our youth are facing moderate to severe anxiety and depression. And 67% of those are reporting PTSD symptoms. That should really worry us. You know, these aren't just figures that we're calling out. These are our young people. These are our students who are already facing stresses in school, academic pressures, right? So when we think about it, and it's been said here by so many of the other speakers, social media platforms, work platforms, they thrive on certain things, these features, these notifications constantly buzzing for you to check, the algorithms that are just waiting for you. You know, you go, the next thing you're seeing, I just Googled, something about this phone, next thing all my ads are speaking to that. So it's actually designed like the same way drugs would operate, stimulant drugs and dopamine. It's designed in the same way. These are how these features are actually being developed. So there's a real call for us, and I want to read something for you here. So there's a company, a group of lawyers came together and they actually sued Meta because they were really worried about the effects of social media use in US teens. And in 2012, they really began to see a dramatic increase in the amount of time that young people were spending on social media. And who knows what happened in 2012? I like to ask questions. I'm a teacher trainer, so I ask a lot of questions. In 2012, Meta acquired Instagram. And so from 2012 to 2015, the Instagram users grew from 50 million to 600 million. Let that sink in a 3-year period. You're growing users from 50 million to 600 million. That means there are teams of people who are sitting down saying, how can we grow our user base? And they're targeting our children, our young people. It is deliberate. And so we, as adults, as policymakers, as parents, have to be very deliberate in protecting our children. So when we talk about the realities, schools, we're employing digital technologies, but how are we going about that? We're leveraging technology for learning, for collaboration. So I have 3 girls. I have a 9-year-old who acts like a 16-year-old. I have a 6-year-old and a 3-year-old. So one of the reasons when we were choosing the schools, I went for these schools, I loved how they incorporated technology into their learning. So for my 9-year-old, they use Teams for her homework, for her curriculum, for her study tools, for sending out messages to parents, for her to be able to communicate with her teachers, with her classmates. And of course, because she's only 9, I make sure that on my phone I can see all the notifications that come in. That's just one platform. There's also emails. There's also a WhatsApp group. There's also a platform that, to be honest, 4 years later, I don't know what it does. There's a tool for me to log on to book appointments with the teachers. There's a tool for me to log on to book her extracurricular activities. There's another tool for her sports. So That's just one child. The second one, she's learning how to read. There's a tool for how to help her to read. There's a tool for mathematics. The firstborn, let's not even forget, she has to do research. There are links for YouTube. They're being directed to YouTube, and it's not always YouTube Kids. So this means that already at a young age, 9 and 6, we were talking about the first age of mobile phone usage, 33. But at 6, at 9, they're already being exposed to these technologies. Thankfully, the 3-year-old maybe has 3, 4 apps. But already school alone, I'm dealing with 20 apps. That's before I've even looked at my work apps, right? So we're already seeing how technology is really formulating and taking hold of us in this day and age. So I want to just read you some examples that were done here in Kenya. There's a famous Kenyan bank, I will not name it, but a study was done last year, and the burnout prevalence was 62% among the employees that were surveyed, 62%. And someone already said it here, it was Stacy, that if you have a workforce that's burnt out, they're not going to be productive. And it wasn't just heavy workloads or the usual work pressures. When they really drilled down to it, it was this ability to always be available, to feel the need to respond to emails. We call it the always-on economy. And in much as COVID helped us in being able to take up digital applications, it also changed the way we work. A company I work for, Helium Health, it rewards, at the end of every year we do awards, so the most fashion-ready, carpet-ready, the best team. So 2 years ago, they started this award called the Email Vigilante. So who can guess what that is an award for? Email Vigilante. Quick response, right? So when they were first doing this award, the person who was awarding said, and this award goes to the person who, before you even hit send, they have even sent a response to you. You can't even finish 2 minutes, they've already responded to you. So we laughed, it was funny. But in 2023, 2024, the same person won this award. Now, I know you don't know many people in my company, but I'll tell you to guess, who do you think won that award? It was me. And so the first year I was like, okay, I must be diligent, I'm efficient. But after the second year I thought, this is a problem, why do I keep winning this award? And so at the end of last year, I was having a conversation with one of my good friends, my colleagues, and he just said something, we were talking about work and life and family, and he said he doesn't have email notifications on his phone. And I stopped and I was like, wait, what? You don't have email notifications? And it's something so simple, but I had never thought to take off the email notifications, and that's why I was winning Email Vigilante, because the minute it came in, whether I was sitting with my children, whether I was at the dinner table, whether I was waking out of bed, whether I was going to bed, whether I was in the car, the minute that notification came on, I felt the need to respond. And so at the end of last year, I did myself a favor. I removed email notifications from my phone. And so this year, I am not gunning for Email Vigilante, let it go to someone else. But also, I've started speaking to my team about this and saying, do not respond to emails out of hours. We have to be responsible in how we are leading our teams, right? And so I'll be very excited when I don't win that award this year. But even bringing it down to our families and our homes. I remember growing up, we used to sit at the dining table. We used to talk about our day. My dad would come in, he'd tell us about work. My mom would tell us about work. We would share at the dining table. But if we think about today, can you think about your dinner times? Are we even still sitting at a table? Sometimes someone is watching TV, sometimes someone is eating in their room. We become so divided because of these devices, right? And so there's a responsibility for us to go back to those days, to reinvent this human connection that we crave, because otherwise we stand to lose it. I communicate a lot with my siblings on WhatsApp, because we're spread across, we don't always get to see each other. And one of my sisters is constantly sending TikTok, Snapchat. Now, I did a count last night in readiness for this, and I counted the number of work app phones on the work apps on my phone alone. How many do you have on yours? Who wants to tell us? Who can give an average of how many work apps they have on their phone alone? I'm talking about Instagram, like your Gmail, Slack, Trello. I have 12 work apps on my phone. And I was just thinking, with these notifications, these constant beeps that we're getting. This is really interfering with our day-to-day life, right? So one of my sisters is constantly sending me messages on TikTok and Snapchat, but I have refused to download any more of these apps, and trying to take back my life from this digital device, Sometimes it's FOMO, the fear of missing out. The way Instagram stories, we have to watch before the 24 hours goes. There's an intentionality about how these features are developed. And in healthcare, we're not escaping either, right? Because in healthcare, pre-COVID, there was probably about 365, we used to say there was a digital app for every day. But post-COVID, we know there's over 350,000, and we think that's only related to mobile phones, not even like web apps or anything. So 350,000, and with over 10,000 mental health applications on the App Store alone. So you can see there's so much technology that's happening on the phones. The need for digital wellness, the need for these coalitions, the need for governance, the real need is there. And even though there are amazing promises of these digital innovations, we've seen in Kenya the burst of telemedicine, right? We have over 7.9 million Kenyans who are accessing telemedicine. That was care they weren't able to get before. We're making doctors more accessible, but we also have to make sure as we are doing that, we're thinking of the mental wellness of our people. And of course, we can't talk about digital health without mentioning AI, whether it's AI-powered diagnostic tools, AI chatbots, AI-driven clinical decision supports. We're using AI more and more, but AI tools don't really have that genuine human empathy, do they? And so there's a real need for us to have a wake-up call. For schools, as you're innovating, doing EdTech, think about mental wellness. Don't let it be an afterthought. Build it into the functionality. As Lillian was telling us about, even with people living with disabilities, how are you innovating for them? How are you being inclusive in these tools? For employers, let your people know that it's okay for them to log out. You don't have to respond past working hours. This always-on economy is going to lead us to a society that is completely burnt out and completely depleted. And for us in the healthcare space as leaders and providers, we need to be very cognizant that as we're building these innovations, we still have to have the human touch. There's a need for that hybrid connection. We can't make everything digital. And just in closing, I want to read something to you about how we should innovate. Let's innovate without eroding what makes us human. Our ability to connect deeply, to think critically, and to live fully. So we really can harness technology as a tool for empowerment rather than one that enslaves. And so the call for us today would really to be deliberate. Turn off that notification from your phone. Go home today, sit down at the dinner table, speak to the people in your homes. Don't be, as we were being told, spouses who just go home, they're just on their phones. In your workplaces, incorporate wellness programs, be deliberate about it. It's not an afterthought. Where your employees have their wellness taken care of, they're more productive. They're not going to leave. You won't have high staff attrition rates. These should not be things that we're thinking about after the fact. And because digital technology is here to stay, we need to make sure that we're doing it. And I see Calvin is coming towards me, so I'll close. I come from a family of preachers, so when we're given a microphone, we can talk and talk. So as I close, I would just like to encourage us to disconnect, make sure that we're not losing what makes us human. Thank you.
Another round of applause for the good Daktari. Thank you very much, Daktari, for sharing that with us. That's very informative, very insightful. Ladies and gentlemen, I just saw Tina Masai walking in. Even though your time had passed, we'll give you some time. We'll offer you some 1 or 2 minutes to give us some keynote address. At the moment, we are supposed to go into our first panel discussion. We are almost out of time, but I want to give us 1 minute to unwind, just to make the transition. So whatever is before you, interact with what is before you. Whoever is next to you, interact with him or her. For 1.5 minutes, then we move into the panel discussions. Thank you. Yes, we are not going to give you this. You just speak to each other.